Hi there, my name is Sheri Gagne. I had a total knee replacement done in Cabo with Dr. Gerardo Mangino. I had collapsed to the floor in October 22, Thanksgiving weekend, and couldn't move. Cortisone injections got me mobile again for 3 months, and I was told that I needed a knee replacement and I had no cartilage left, that I had arthritis. I did not know any of this prior to Thanksgiving weekend, so this came as a total shock to me. We were instantly online looking at Mexico, as my sister-in-law had already been waiting 2.5 years for her knee replacement here in BC. And lo and behold, 5 minutes after we entered online for a quote, the Pulse network gave us a call and wanted to know when we wanted to book next week. I'm like, give me time. This just all happened, right? So after the cortisone injection wore off, which was the 3 months that they said it would be, we went on holidays to Mexico, and I knew right away after walking in the sand on the angle and everything that I needed a total knee replacement. My knee was going to go at any time. So I called Dr. Mangino and Valerie at Pulse and said, book me, Dano, I need surgery. And my sister-in-law was getting hers done on March 13th, so they had me booked for March 15th so that we could travel together. Now, I had been looking at Puerto Vallarta from that initial phone call, but my sister-in-law was going to Cabo for hers, and I'd done my own research, but she's so thorough, and she wanted to go to Cabo. She knew some family members there as well. So I switched to go to Cabo, and Valerie assured me that any of the doctors that I had chosen and spoken to, she would refer a family member to them. So I was totally comfortable in the decision to switch over to Dr. Mangino in Cabo. The cobalt chrome metal used in the knee replacements is totally fine with me. I have a metal allergy and I was concerned about that, but lo and behold, it has caused me no grief at all. And thank you to Dr. Mangino for putting my mind at ease on all of that many, many times, because that was an issue for me, but he was very thorough in assuring me on that. Now, I am only in 6 weeks of recovery, so exercise is my life. A perk is that I don't have to wear the knee brace anymore, and I can slow dance with my husband. Rock and roll yet to come. To be prepared is my advice. Do your exercises, legs and arms. The arms will work a lot, pulling you around on the bed, etc. And make sure you notify your airline that you will need travel assistance at the other end when you are done your surgery. Now, we hired a private nurse via Dr. Mangino's recommendation, and we highly recommended that. Iris was our nurse, and she was wonderful, compassionate, and is now a friend. And we communicate on Facebook, etc. now, so that there's a perk out of all of this. The 7 to 10 days recommended stay time was adequate for us. We stayed 10 to 12 days, and that was a bit too long. We were ready to go home. Another recommendation would be to download a translator app, as the hospital staff do not all speak fluent English. And also to download the WhatsApp, as Dr. Mangino and Iris communicated to us via that app. Now, from home, we highly recommend that you bring one of these ice packs with you. Much better than a Glad bag with ice cubes and stuff from the hotel in it. That seemed to leak all the time and was a source of grief for us because we were constantly having wet bed sheets, etc. Another thing to bring is something to protect your surgery, leg, hip, whatever, for when you have a shower. We did not think of that, but thankfully Iris, the nurse, provided us with the bandages when she changed, and then protected us with basically a garbage bag wrapped over our surgery site on both of our knees. You don't need to bring any shoes. Your feet are too swollen to do that. Bring slippers, flip-flops, that sort of thing. Save some space in your luggage. Pack clothing that is very loose-fitting and easy to get in and out of. We spent a lot of time in our 90s sleeping and healing, and don't be a hero. Give in to that. The sleeping and healing part is highly recommended, because reality will hit when you get home, and you will value what you had in Hampton while you were there. Another thing is to stock your room with water. The Hampton only gives you 1 free bottle of water, which was a shock to us, but that's their rule. And I understand that beer is cheaper than water, and we can't drink beer because of the meds that we're on. Now that leads to another recommendation, is that you get your prescription ahead of time and buy in BC, because the medication is cheaper when you purchase it in BC from a pharmacy here. For the H Hospital, we would like to see them train their staff on to do a pre-auth on credit cards rather than a full charge and refund for the incidentals. What happened was, rather than doing the pre-auth, they did the other thing where they charged and then refund. But with the exchange rate, that left me $150 short and my sister-in-law $750 short. So that would be my biggest thing for the hospital, is to train your staff on how to do a pre-auth or a hold on the funds, not to charge it right out. Now, Dr. Mangino is refunding us the money, but he shouldn't have to do that. The $150 out of his pocket could have easily been avoided. And I appreciate that, Dr. Mangino, but really the hospital needs to get their game together on that. It is very great that Dr. Mangino's clinic, the hospital, and the Hampton are all located basically in a circle kind of thing. It makes going to the hospital for extra exams, x-rays, that sort of thing, blood work, and then booking appointments with Dr. Mangino at his clinic, and then going back to your room, very, very easy. Now, as a partner of the clinic, it would be nice for the Hampton to have a few rooms with walk-in showers for their surgery patients that they hold these rooms for. My sister-in-law and I traveled together and both had surgeries days apart. We had no other person from home coming with us. We figured we could take care of ourselves together, teamwork. We shopped ahead and stocked the room and with food to survive, because we didn't know how mobile we were going to be. But there is an opportunity for some entrepreneurial Mexican to make some money there, because there's no food delivery service from the market, and it would have been nice to have that delivered to our room. Now, would I go back there and do this whole thing again? Absolutely. The team was professional every which way, right from the consult to the Zoom meetings and booking the appointments, the admission, everything was perfectly spot on. Do it again in a heartbeat. And the best thing is that Dr. Mangino's care did not end when we left Mexico. He continues to communicate with us via the WhatsApp, looking at photos if I have a concern or anything, and reassuring me that that's what it's supposed to look like, and go from there. So other than that, if you have been waiting for a knee replacement or any kind of surgery in the BC system, go for it. I highly recommend it. Unfortunately, there is a price tag, and if you can afford it, go for it. Your health and your happiness is much better, because the BC system is failing us immensely. Thank you, and wish you all luck. Thank you.